It's a great pleasure to be here with you all the CXOs and ITDMs of the country who are playing a very important and crucial role in healthcare. I'm extremely thankful to Tech Plus Media for inviting me. It's a great pleasure. If there was a time where we needed the CXOs more, this is the time. Pandemic has taught us that we just cannot segregate digital innovations and digital involvement in healthcare, which was not as good as in the past. And we have seen the role digital interactions have played in last 1 year. 1 year, we have learned so much, and most of it was dependent so severely on digital interactions and was so significantly contributed by the CXOs is commendable. I take this opportunity to thank you all from the bottom of our heart and also to acknowledge the way you have helped us clinicians in tackling the pandemic. So you all can pat yourself on your back for being part of this journey, especially in last 1 year. Healthcare had an unprecedented crisis last year. We never knew this disease. We never heard about it. We didn't know how does it present, and we didn't know how to treat it. Nothing was known about the disease. And anybody who was treating it was literally treating blindly. And as if you all remember, that we all learned while we were treating the patients. A very famous saying in innovation that you should learn to fly the plane as you are constructing it. Nothing could have been truer than what happened in this pandemic. Suddenly, all our patients disappeared from the hospital. People were reluctant to come to the hospital. Our incomes dropped to virtually nil in the first couple of months. Entire country was in lockdown. We didn't have enough gear to treat people. We didn't have enough training to treat people. The digital involvement came so handy in connecting with the patients, in training our own people, in sharing the reports, in sharing and consulting doctors while the patient were infected and in the hospital. There was a galore, there was a severe involvement of all the health tech in the world, which were trying to make clinicians' life a little easier and support the patient and pandemic. Very commendable. We realized that there are various new ways of treating people, and especially in the pandemic and probably post-pandemic. This pandemic just didn't affect us in terms of sickness. I think our senses, this pandemic has transformed our lives. This pandemic has made us feel that you need to look at the way we deliver healthcare with the new eyes. The transformation, the way disease was presented, and the way the rest of the diseases are presenting now is extremely mind-boggling. Now the patients, if I remember correctly, first few patients of our COVID, when they came to the hospital, they came with a full-blown heart attack. We were just new in the system. We didn't know that the COVID can present with a heart attack or with the bleed in the brain. And both presented as a first symptom. Now we are realizing after almost a year that many of our COVID patients who had a severe involvement coming back, the serious breathlessness, cardiac problem, and various other problems which we did not see earlier. So that means that our lives have been transformed. And how do we track it? We can only track it by you all, those who are good at health tech, in providing us a solution, providing us a means of identifying it, and providing us the way to treat them going ahead. We were lucky that as the country saw an economy, as they were saying, where there was a V-shaped curve, we went down and bounced up completely. Looks like that the same thing repeated in healthcare also. We went down very, very badly, but we have all bounced up back. We are back to the pre-COVID state, no doubt about that. But having said that, all those patients from 1 year who are still sitting at home are still not coming to the hospital. A lot of vaccinations have been missed. A lot of cancer care treatment has been missed. A lot of surgeries have been missed. A lot of patients with the chest pain are sitting at home and suffering. A lot of surgeries have been missed. Probably once we have our full-blown vaccination program implemented, all these people will start coming back to hospital. That will put again enormous burden on the healthcare, both in the private and public sector. I think that is time and probably the role of digital involvement will be more effective. How do we be prepared for future such events? I think we need to look at the our experiences which we got in last 1 year and make sure that we implement it when while we are constructing the hospital or we are creating a new facilities or whatever we are going to now must have the implemented strategies or the lessons we have learned in last 1 year. For example, we have seen that number of communicable diseases which could be communicated in the hospital, like acquired infections, have gone down drastically. That means that washing our hands and using the mask has been very, very helpful. I think we need to continue with such practices. We need to monitor our performance in the ICU, especially acquired infections, and ensure that such good practices don't just die down. We must act on it in wholeheartedly and make sure that we continue with it. We have seen how the number of deaths have gone down in the ICU. We have seen that number of typhoids have come down because it was all mouth to hand to others disease. Whatever it has a fecal-oral route. Whatever comes out and we touch it and we through the mouth, it gives us the disease. Now all it has gone down. So there has been a significant changes in such diseases. So that is another lesson which I have learned. I think we have learned that when we were fighting with the pandemic in last 1 year, we realized that a lot of area of the hospital were not really under the negative pressure. That means we could suck out keep the air conditioning and keep the system in a negative pressure, so the infection doesn't come in from spirits from within. So that was a new learning, and now most of the hospitals which have dealt with COVID have handled it at their levels. So all those new learnings have been implemented, and now we have realized the value of the changes, air changes. We realize the value of frequent hand washings. We realize the value how to build that in a new hospital. All those learnings must get implemented in the new hospital. That will change the process, that will improve the system, and that will improve the care. And as government has shown the path, this budget has been very, very significant. I think we have seen the best budget since independence in healthcare domain, where the government is not only tackling whatever is happening in our lives on day-to-day basis, is also committed to invest and boost the site disease entry point. Like they are spending to wellness clinic, they are spending time into nutrition and money. They're going to invest in Jal Jeevan, good water. They're going to invest in Swachh Swasth Bharat, Swachh. and Swasth Bharat. They are investing into a good air. So all that would eventually lead to a healthier people and healthier nation. So all such things which probably were not thought of. Nobody thought that health is important for economy of the country. No one ever thought that health is a prerequisite for keeping a nation economically healthy. And one pandemic has shown them that how it can successfully destroy the economy. So health has emerged as a premier or first prerequisite for education, for economy, for everything in life. If there is no good health, there will not be good economy. Now, my viewpoint about the digital involvement of the healthcare delivery, especially in delivery, I know that when it comes to technology in terms of instrumentation and pharma, they are fairly advanced. They have incorporated digital involvement a big time in a big way. Now, when it comes to healthcare delivery, traditionally in India, we have been not performing as compared to our counterparts in Europe and USA. We have really been on a back foot. The reason is very simple. In my opinion, after having spent close to 45 years in healthcare, I have realized the only shortcomings, the only obstacle in our life in making us digitally hyperactive is the cost, is the investment by the healthcare institutions into technology, especially digital technology. This pandemic has literally held us by the neck and made us realize that you need to invest significantly into digital innovations, digital deliveries, everything which can decrease the cost, which can increase the output, which can increase the accessibility, and which can make sure that we deliver healthcare optimally. I think we all need to realize this fact and we need to incorporate into our spending as a very necessary uh, mm, part of building a hospital. There's no more we can shy away. Even if you are a small hospital, even if you are a 5-bed hospital, even if you're a 50-bed hospital, the big hospitals are investing, but medium and small hospitals are not investing at all. We all need to get together and ensure, and we all must rise to support each other and ensure that we all are digitally and have the cutting edge of technology in the world with us in India. Because our people deserve the best as the rest of the world deserves. And I'm glad that our Prime Minister is talking about Atmanirbhar Bharat. And Atmanirbhar Bharat also means digitally Atmanirbhar Bharat in healthcare delivery. The very fact that innovations and a lot of innovations are happening in this country, but they're all going elsewhere. I think it's time has come for all of us to adopt it. And I will urge all the CXOs, all those who are operating as a CTO or CXO, whatever you call them, please join hands with the higher management and ensure that cutting edge of technology is available to us to deliver a better care. Let's build Atmanirbhar Bharat in every sphere of healthcare delivery and let it be a digitally a successful one for everyone who's delivering healthcare in the country. Thank you very much.
For more updates from CXO TV, please like and subscribe to our channel.